Okay, let's get started. Welcome, welcome, welcome. So this week we're going to talk about the skeletal system. No bones about it. Okay, I'm sorry. That is such a bad joke thing, whatever. And I just really could not resist. So let's get to it. Did you know that adults have 206 bones in their body? And that is very true. However, when you're born, a neonate has 300 bones in their body. So the question is, where do those 94 bones go? Basically, they kind of meld with other bones to become one, and we're going to discuss that, of course. But I just thought this was an interesting fact that that babies are born with more bones than the adults who give birth to them. Okay, so there are two types of bones in the structure, and they're defined by the structure, how they are made. Now, you probably think of a bone kind of like a chicken bone, which is that long bone, solid, okay? But there's actually, and those are the cortical bones. They make up the structure of the human body. But then we have other bones known as cancellous or trabecular bones that are soft and spongy. These are bones such as at the ends of long bones, and you could tell, okay, the ulna is a long bone, but where it attaches to another bone is soft and spongy. Also in the pelvic bones, the ribs, the skull, and the vertebra in the spinal column. Now, that makes sense, doesn't it? Because we kind of need that flexibility as opposed to the rigidity of the cortical bones, the structure bones. We need the flexibility in other places, particularly in the vertebra, right? Pelvic bones. So it is important that the body be constructed in a way for maximum function. And just like in the real world, everybody has their own job description, even bones. I know you wouldn't have thought that, but now you know. Okay. That's why you come here, to know stuff, right? All right. So most of the time when we're talking about the skeletal system, we are referring to adult bones, the 206 count, okay? Because that's where people are in the maximum of their lives, okay? And most of these bones you're probably familiar with, such as the various bones that construct the cranium, right? The protection of the brain. And then you have your maxilla and your mandible. Your maxilla is your upper jaw, your mandible. Oh, I don't think you're supposed to hear that creaking. Okay. Oh, by the way, in case you didn't know, women are known to hold stress in their in their jaws. Just thanks. Okay. Yes. We have so many gifts being women. Okay. Temporomandibular joint. Temporo. That's okay. Temporo relating to the temporal bone in the skull. Mandibular having to do with the jaw, and joint is the joint. That's this little hinge that enables you to chew your food, say words, and hear that little click every time. Okay. I guess if we didn't have these little foibles in our structure, what would life really be like? Okay. So now we go down to the rib cage. The rib cage are bones that spring off of the vertebral column, right? And come around to the front. And their job is to protect the thoracic organs. So you got your heart in there, which is pretty important. And then, of course, your stomach and your liver and your gallbladder. There's all kinds of stuff in there. Okay. And then we come down the vertebral column and we get to the pelvis. Now you'll notice that our illustration here is a woman, and you know how we can tell that is by this shape, the outward shape of a pelvis. A woman's pelvis is shaped like a heart. Oh, isn't that nice? Is, you know, for childbirth purposes, actually. All right, the baby just fits right in there in that little crevice. Don't worry, the sacrum and the coccyx don't poke the baby. That's behind the baby. Okay. And then we have our lower extremities. So you have your hips and your femur, the longest, largest bone in the human body is the femur, the thigh bone. Anybody tell me what the smallest bones in the body are? In the ear, the stapes, the malleus, and the stapes, the malleus, and the other one. The three tiny bones in the middle ear are the smallest bones in the body. And actually, if somebody jumped off the Empire State Building and crashed, they would most likely break every bone in their body with the exception of those three bones inside the ear. That's how well they are protected. Okay. All right. Any questions so far? Don't jump off the Empire State Building just to see if this is correct. And I don't know this for a fact. I have never done it either. Okay. Actually, I was born and raised in New York, and I don't, oh yeah, maybe I went to the Empire State Building. Now I can't remember. Okay. I think I went to the restaurant at the top. Anyway, now we're going to talk about the skull. You know, that hard as a rock, right? That nothing penetrates the skull, especially when you're trying to teach people things. Uh-huh. I know, I'm a teacher. Parents know this as well, regardless of their gender. Okay, so, oh, here it is. The anvil, the hammer, and the stirrup. Those are the three smallest bones in the body. And as we discussed, you see this orange area, the temporal bone that's on the side right here around your ear. And that's why you get temporomandibular joint, the hinge, okay? Then you have the sphenoid, where if you have annoying people in your life, your headache may occur. No, that's not what, okay. You just say, you're bothering my pink area. Okay. And then you have your frontal section of the skull, which protects your frontal lobe, which is the area of the brain that is important for decision making. Parietal, and why do you see 2, 2, 1? Okay, and that's because parietal bones are divided down the center, so you have one on either side. You have temporal bones, one on either side. But the occipital bone, which is the base of the skull, there's only one, because there's just like, it just covers both sides. And then the same thing with the frontal, it covers both sides. Okay, so that's why you have only one of that. And in case anybody is thinking this, which I'm sure you wouldn't, but your actual skull does not come in pretty colors like that. You just put it like that so you could easily tell the difference between the 8 bones. I know, I think that Mother Nature or God or whatever, however you want to refer, the point is the creation of the human body could use a little color, okay? Not just in your eyes, but they did not invite me to the meeting. Okay. All right, upper extremities. That's these, your arms, and it includes the clavicle, this bone right here. You have one on either side that gives the structure and helps to connect the upper extremities to the torso. The scapula is that triangular thing that sticks out back here. Okay, you have one on either side. And then you have your humerus, which is the long bone between your shoulder and your elbow. Okay, why they call it the humerus, I don't know, but that leads to referring to your elbow as the funny bone. Now, who here has hit their funny bone really hard and actually laughed? Yeah, no, I think that's funny, as in, you know how you say, how you call like somebody who's 500 pounds and you call them slim. Okay. Yeah. I think that's that opposite, the opposite
Humor.
language. Okay. Yeah. All right. So, but this I find is really, really interesting. So the hands, I'm sure you're familiar with your hands, right? Hello. Okay. And your feet contain 106 bones. That's just your hands. I mean, we're talking wrist to fingertips and ankles to toes. Those four elements, components of your body, are more than half of all the bones in your body. There's a lot going on in here and down there. You don't really want me to take my shoes off and show you my feet, right? As point of illustration. I'm going to skip that, because it could be considered rude, you know, but anyway. So the point is that your hands and your feet have a lot of responsibilities. They have a great deal of function, which is why they are constructed of little tiny components of bone, as opposed to something like your arm, the humerus, or your legs with the femur. Okay, those extensions require a lot less mobility and support than your hands and your feet. So be kind to your hands and your feet, because that's half your skeletal, more than half your skeletal system right there. Yikes. All right, and now we have the pelvis. As you can see, the heart-shaped means this is a woman. And in this bone structure, the individual human is actually able to walk and function with regard to their, and this is also the attachment process for the lower extremities. So you can see right here where you have the sacrum and the coccyx, which are the bottom two components of the vertebral column. Okay. Now, this is really what I like about this picture is, can you see those ridges, if you will, or the stripes in the sacrum? Well, that's because the sacrum, remember we talked about the neonate that's born with 300 bones, and then all of a sudden you get to be 20 something and you only have 206? Exactly. They fuse together into one bone. So those 5 bones fuse together into one bone, the sacrum. And the coccyx is the same thing. Multiple bones fusing together. Now the coccyx, you know, if you ever slipped and fell on your gluteus maximus, the coccyx is the, ow, sorry, that was loud. Okay, you know, that's the bone underneath all of the gluteus maximus and the muscles, but we're going to talk about that next week. Okay. The ilium is the crest of the heart shape, and that's basically your hips. And you can tell this that this is a woman because of the way those hips are formulated by this bone. And you can look at any human being and see one of the primary differences when you look at a man and a woman. I said one of the primary, okay, is the fact that women have hips and men are like straight down, okay? All right. Another thing I want to point out to you, especially because this is medical terminology class, is ilium, I-L-I-U-M, refers to this hip bone. But, thank you, medical terminology, I-L-E-U-M refers to the end of the small intestine where it meets up at the appendix with the beginning of the large intestine. So I-L-I-U-M is part of the skeletal structure of the body. I-L-E-U-M is part of the gastrointestinal system. It's like having cousins with the same name, but it's spelled one letter difference. And this is why, as you are learning medical terminology, you need to really pay attention to the spelling of the words, because one letter difference is a whole other body system. And in this particular case, I-L-I-U-M and I-L-E-U-M are in basically the same area of the human body. They're, you know, down here. Okay. So again, I have to tell you, as you're working on learning this, you got to slow down and you got to really pay attention to spelling. Okay? Very, very important. The lower extremities, the hip joint, the pelvis, we just talked about that. The femur, which is the longest bone, the largest bone in the human body. It takes a real lot of force to break a femur. So you see a patient who has a fractured femur, you got to know that it happens in car accidents, but that requires a tremendous amount of force. Okay, the patella is your kneecap, which kind of is in front of where the femur meets the tibia. And look at the structure of these bones. Does it remind you of something? The structure is similar, almost exactly like the structure of the arm. You have the long bone coming off the torso. In the arm, it's the humerus. In the leg, it's the femur. Then you have the patella, the kneecap, that's covering the joint. You have the joint. In the arm, it's the elbow. In the leg, it's the kneecap. And then you have two bones, tibia and fibula, versus ulna and what? What's the other bone in the arm? Okay, we'll go look. The radius, right? So now can you see, look at the structure of the arm. The humerus comes off the scapula, and then you have the elbow, and then you have the radius and the ulna. And now we have the femur into the patella, the kneecap, and then the tibia and the fibula. Okay. And the feet, again, are structured very similar to the hands. You have your tarsus, your metatarsal, and your phalanges. And in your hand, you have your carpal, your metacarpal, and your phalanges. Okay. All right. Now, one other thing that I wanted to make sure that we discuss are the terms used for different types of bone fractures. Okay. Because regardless of whether you're taking the clinical side or whether you're taking administration, health information management, you have to know that knowing that a bone is fractured is insufficient information. You cannot determine how to repair or fix or treat the fracture if you don't know exactly what type of fracture it is. And if you're going into health information management, you cannot possibly code and report the fracture without knowing exactly what type of fracture there is. So we have the open. Now, the open is the easiest to diagnose because this is a patient who actually has a bone sticking out of some part of their body. Yes, exactly. Not a good look. It's also, as I like to say, one of the easiest things to diagnose, and the receptionist could probably do this. But still, you should take an x-ray just to make sure. Okay, then you have a transverse fracture, which is a good fracture. I mean, if you got to fracture a bone, a transverse fracture is good because you can see how, well, a transverse, remember we talked about this, transverse across, okay? But this does not need any manipulation to put it back into place. They can just put a cast on it and allow it to heal, and it has the best opportunity to heal smoothly and not impair the patient further, as long as they don't mess during the healing process. Okay. All right. A green stick fracture is a partial fracture, and it comes somewhat from bending the bone, which is why you see it's fractured only on one side. I can post the power. It's Latoya is asking if the PowerPoint can be printed off after the class. I will post it in announcements, okay, as a PDF. All right. And then of course you have the recording, which will include my dulcet tones and of course my witty banter. Okay, so a green stick fracture is a fracture that comes from the bone being bent forcibly. And very often, a green stick fracture can indicate physical abuse. So everybody, the clinicians as well as health information management and administration, need to be aware of this so an investigation can ensue and a report can be done. Okay, the green stick fracture shows the break on only one side of the bone because the bone is being bent. Okay, not in a good way. All right, a commuted fracture is, and you can see the difference between that and the transverse, how the commuted fracture is cleanly broken transversely, but then kind of crinkly in the middle. Okay, so this also is relatively easy to heal as long as none of those little parts have broken away, which can then cause problems. Segmental is two transverse parallel fractures. Also, I'd be asking questions. All right. A closed fracture, you can see, is similar to the open fracture without the penetration of the skin. But we still have not only we have a full break. I mean, there is separation, and this is going to require manipulation by the physician to put the parts back and aligned, so then the cast can be put together and hopefully a clean healing is done. Then we have a spiral fracture, also a very strong indication of abuse. This is done by actually twisting. Yeah, really. Ow. Okay. And I would say 9 times out of 10, not an accident unless the hand is caught, but you know, okay. Investigation. Okay. A linear fracture is kind of like a transverse fracture. It's a pretty clean fracture, only it's vertical within the bone as opposed to across. And impacted is going to be, the way I like to describe it is it's gravity based. Okay. So this could happen to a teenager who thinks that what's that movie? Donkey? No, not Donkey. Jackass. See, that's close to Donkey. Okay. My mind. Okay. But so they jump off the garage roof and they think that's funny and they land on a hard surface that could easily cause an impacted fracture in one or more of their leg bones. Okay. And as I like to say, as a coder, if we had a code for stupidity, we wouldn't need about 10,000 other codes. But again, you may or may not become a physician. You may or may not be in the presence of needing to diagnose the type of fracture. But again, as a clinician or as an administrator, particularly health information management, you need to understand the differences. And yes, even if you're not the physician, you still, as a healthcare provider, need to say, this child of 5 has a spiral fracture or a green stick fracture. We need to report this. Okay. And remember, and I know I was a guardian ad litem for 5 years, and I know how hard it is. I do know how hard it is to report somebody for possible abuse or neglect, whether it's a child or an elder person or anyone. Okay. The fact is that you need to know, and I want to start layering this in your head. So when you're on the job, you hopefully will have the strength. Okay. It's going to cause butterflies in your stomach. It's going to make you nervous. But the fact is that number one, you do not have the power to send anybody to jail or to prison. You do not have the power to arrest anybody. All you're doing is starting an investigation. And number two, think about how you would feel if you did not, you kept this to yourself, and that patient came back through your hospital, through the morgue. Okay.
That'll do it.
That'll do it. I figure my common saying is pick your motivation.
That was one.
I don't care. You don't want to get sued. That's a good motivation. Okay. Or you want to think of possibly saving someone's life. That's a better motivation. I don't care what your motivation is. And also remember that reporting this to the hotline is anonymous. And it is against the law for them to release your name as the person who is reporting, but you will be contacted by an investigator to say what you know, to let them get the permissions that they have to look at the x-rays but you don't do that. You're just raising your hand and saying, somebody needs to investigate. Somebody needs to look into this, because a member of my community is in trouble. And this also includes adult women. Okay. Yeah. I mean, it's easier when it's a child or maybe an elder person, because I don't know how to do that anymore. Senior, I don't know what senior is, but an elder person. But the fact is, in the middle, we have women who are being physically and emotionally abused and don't know how to get out of that situation. And if you can help them, that's a wonderful thing. Okay. You do not need permission. This is an automatic HIPAA report. Okay. This is not, keep it a secret. This is not a HIPAA issue. And I heard one doctor say, well, the mother didn't want me to report this to, you know, about the child. And it's like, first of all, you don't have the discussion with the mother. The mother has no say in this. The other thing is, if you are in a situation where a child or a senior elder or a potentially abused woman is in the examination room, you have to make sure they are alone. You cannot have the potential abuser standing there. And I had a situation, one of my students came to me and said, the situation was the child was being examined and the mother stood right there the whole time. And the physician never asked the mother to leave the room. Yet there were signs of abuse. And little girls do not get vaginal infections from bubble baths. Just saying. Okay.
True.
All right. So I say this again as one layer in strengthening, because I know how hard it is to make that call. I had to do it myself, even though I knew I was 100% correct. And my supervisor told me to make the call. And it still took me 10 minutes to dial the phone or push the buttons, whatever. Okay. All right. What am I going to tell you? What I tell you every single week. Review the vocabulary often. Use your medical dictionary. So as you're implanting these words in your brain, you are doing the accurate definition. Okay? And please query as necessary. I am here for you 7 days a week. And anytime you want to discuss something, you want to go over details, you're not really sure you understand, email me, because it helps me feel needed and wanted. And I really appreciate that. Okay. We can email back and forth. We can set up an appointment, phone, Zoom, FaceTime. I am very versatile in communication technology. Okay, except yesterday when my Wi-Fi went out. But anyway, all right. Any questions?
No, you just said you'll PDF it, right?
Yes, I'm going to PDF it, and then I'm going to, after I put the recording, I will PDF it and post it under announcements, and it will be there within the next half an hour. Okay. All right. Thank you. Wonderful people. I'm so glad you come to listen to me pontificate about the skeletal system. Have a wonderful day, and make sure before you go to sleep at night, count all your bones and make sure 206 are there. Okay. Just in case you don't want to be losing any of them during the day. Have a wonderful.
Bye.